We have Dr. Sandy Nye again with us today. She's going to talk about aromatherapy. Sandy, you're a naturopath, but aromatherapy, in my opinion, is your passion from knowing you for so many years.
Well, certainly essential oils are my passion, and aromatherapy is part of that. So yes, it is a passion.
Please explain the difference to people who don't get that.
Well, aromatherapy is using essential oils, usually in different therapeutic ways, to do treatments, whether it's through topical massage or through inhalation, or if one is qualified to do so, through internal use. Whereas essential oils really are the tools of that trade, so to speak. So you would use the essential oils to perform the different acts that fall under aromatherapy.
Sounds naughty.
It does, rather. Good addiction to have. It's like
Right.
soap.
But I'm going to start at the beginning.
Sure.
Where did it all begin for you?
I think it began in childhood because I grew up with a grandmother who was a herbalist, and the smells with working with the herbs are very evocative. And then growing up, I became interested in not just what these herbs were smelling like, but what could they do. And then proceeded from there to try and find a niche of what did I really want to do with my life as I became an adult for studying. So I trained as a nurse and midwife, and after that as a naturopath. And then aromatherapy was sort of part of that process for me of wanting to learn more about what the essential oils could do that come from these herbs, or that originate from the plant material. So that really was the earliest days, and there was very little available other than possibly lavender, or but a peppermint occasionally from Bulgaria if you had family who were traveling. And once I smelt, I think, the first lavender oil, I was completely hooked, and really just had that resonance. I needed to work with these things. So I trained in aromatherapy, then I taught aromatherapy and anatomy and physiology, where I taught aromatherapists how to become qualified. And the interest for me was more clinical a lot of the time, rather than metaphysical, which is important, but it doesn't excite me in the same way as sort of dissecting something scientifically does. And I came across the opportunity to go to France and study some aromatic medicine, and then found ways to incorporate that, because that's not the norm in this country.
So you slowly sort of brought it into your nursing practice with your midwifery?
To some extent, as I said, at that time we only had lavender available, and I think in some of your midwifery experiences with me, you've probably remember the oils, and I remember your aromatic children.
Oh my word, the most incredible birthing experience is to have it with the right essential oil. I did mention it in my episode with Simon.
Did you?
It's still, yeah, I mean, it's 17 years ago.
I know, it's profound.
Just almost to the day 17 years ago.
Yeah.
Amazing.
So it didn't just stop there. It's quite useful to have had around, but in nursing there wasn't really any interest. It was more when I became setting up my own practice as a naturopath that I could really expand on that. And then my special interest is in the aromatic medicine aspect in the practice, so that is. Whereas the passion aspect also comes into the whole natural products, formulating the ranges and all of that kind of thing. So it's available topically. It doesn't have to all be internally.
You mean the skincare range that you've been providing people
skincare.
Under your label Serendipity, that's now incorporated into Foster and
That's
Walsh.
right, yes.
Right.
And that started really with patients saying to me, oh, what do you use on your skin? I think it's quite a common thing that women ask other women. And
no one's asked me.
Well, I think they would walk into practice and smell. Something smells good, and then, it just goes that way. And then I'd say, well, it's something I make. It's my own toergoed. And make some for me. And that's really how it started, was, sharing what I make and use for my own body, my own family, and my own skin with patients. And that developed into a side business of people having individual prescriptions made for them if they had skin conditions like rosacea, and changing their formulations as their skin changed and as their conditions improved. And it developed from there into something more commercial, as well as still having those patients for whom one makes the individual prescription, using the essential oils in an aromatherapeutic sense to bring about a change in their health.
Let's bring it back to the practice of aromatherapy. Now, not everybody that reads a book and that understands different aromatherapy oils, that has a keen interest in it, can call themselves an aromatherapist. So if you could please just clarify that.
Yes, that's quite a loaded question, because, and for my sins, for all the years I spent serving on different councils in the Allied Health Profession Council, and serving not just for aromatherapy but also naturopathy.
You were the chair of the Aromatic Association of South Africa.
Well, they were in 3 organizations in South Africa to date.
So if somebody has a massage practice and they also call themselves an aromatherapist, or they offer the services of aromatherapy on their price list, who controls that? Because, you know, although, you know, aromatherapy is beautiful essential oils that you maybe find in a product, it's really powerful, and some of them are contraindicated for certain medications with pregnancy. So if you could just tell us, where do you draw the line, and who polices this, and how important is it to police it?
I think without becoming too draconian and over-policing everything, which very often can be the death knell for professions, but particularly in the natural health arena, there is a need for regulation. And yes, people do call themselves anything, including aromatherapists, whether they have the qualification or not, because that's their perception. Well, I can do it, and I've read a book. And there's actually more to it than that.
I think because you mentioned teaching physiology and anatomy, that is essential when you're an aromatherapist.
There is, and most aromatherapists will have undergone, certainly the modern cohort, any time from the 2000 onwards, they would have undergone at least a 2-year diploma program, usually from an accredited school. And that gave them certain credentials. They had national exams to pass. They were also recognised by the Allied Health Professions Council and could then register as health professionals, because it is a registered health profession in South Africa. And it's important that those people are actually supported by the public when they actually go for treatments, because they have the credentials. They have regulations that govern what they may and may not do. And because these are such powerful molecules, it's important that someone has some scientific background and understands exactly what chemistry is that they're working with. These are chemicals. They're natural chemicals, but you're right, they're potent and they can have side effects. So if you've just read a book and you haven't undergone anatomy, physiology, pathophysiology training, you're at risk. The public is at risk for what they may receive. They may receive great service, but they may not.
And even as a layman, you know, if you want to pour some essential oils into your bath, I mean, I've done that when I was very young. Poured a whole lot of different citrus oils into my bath, and I jumped out of there burning. My skin was burning from the orange and the citrus that was in there.
And there's all sorts of myths that need busting about how these oils can be used, and including how they need something that will disperse them appropriately in a bath, commonly applied, but you need to know what you're actually doing. You can't just put them into a little bit of milk necessarily, which is what people used to do a lot. You need something that disperses or solubilizes them so it's spread throughout all the water and doesn't just float on the top.
So that's what happened to me.
That's what happened, and it's happened to me, and I think it's happened to everyone who enthusiastically uses oils for the first time. But there's a lot more to it than meets the eye or touches the skin.
So aromatherapy is a recognized modality in South Africa, but therapeutic aromatherapy can be either inhalation of essential oils, a topical application, even the ingestion of essential oil capsules. Can you expand a little bit more on that?
Sure. You're right that those are the methods of application that are common, but the scope of practice will define who is allowed to use them within the 11 modalities that are registered in this country. And as far as topical use goes, certainly the first people who should have access to them are the therapeutic aromatherapists, because they're trained to use them that way, either in massage or in baths or in creams, lotions, inhalations. However, lots of people do use them without having that background, because the oils are freely available. You can buy them over the counter. And as much as that's wonderful for a profession to have their tools available, it also can be a little bit daunting for the people who are trained in them, because it allows everyone to use them. And then if there's anything that goes wrong, the actual profession is called into disrepute.
Sure.
And essential oils are called into disrepute, and that could often be it's because how they're being used, and they may have been used inappropriately. Then when it comes to their internal use, in South Africa, the only people who are allowed to use them internally are diagnostic professions. So that would include naturopaths and mostly phytotherapists, because those two modalities actually include in their training botanical medicine and the principles thereof, which is the basis of essential oil therapy. And you're not allowed to prescribe anything internally unless you are a diagnostic physician.
There isn't a product available in South Africa anymore. There was. But there's not anymore as far as I know.
Not commercially. We still do have, for example, oregano essential oil capsules available, which we use a lot in our practice for various conditions, but they used to be available quite widely until I think about 5 years ago. And then I think with all the changes in the medicines regulations, many things went on and off the market, which is quite a pity because they were well controlled and they were extremely well made. It was a Belgian product. And the oils from this company are excellent, and certainly the formulations were superb.
I know they're effective because a lot of our readers wrote in about it. So you've got your ingestible essential oil.
Yeah.
What are the golden rules when it comes to applying oils topically? Obviously, some oils you cannot apply directly on the skin.
It's not just some oils. The latest research that has been coming out in the last year or so shows that any essential oil is best diluted. I know that people still say it's fine to put a drop of tea tree on a spot or a bit of neat lavender onto a burn. It has its place, but you need to be very careful and understand quite a lot about the physiology of what you're doing when you put something undiluted that is highly concentrated, as essential oils are, onto the skin directly. Because people have different reactions, their skins react differently. And once again, it's not that the oils don't work, it's that they are inappropriately applied, which gives them a bad rap sometimes.
So quite an important area would be babies. Baby
absolutely.
massage and baby oil, essential oil in a medium. Some mums put it in a carrier oil and they massage the baby's feet.
Even that you shouldn't really be using on babies under 3 months, in my professional opinion, because baby skin is so different. They're so sensitive, and even inhaling those oils, their lungs are still very new and developing, and you can get essential oil overload very quickly. But it's more about not so much the inhalation, but the topical effects. And I've seen babies who've been horribly burnt by people putting essential oils in. And when you do, you need to put it into the right dilution with the right carrier oil, and always in a carrier oil.
It's not just, here's a carrier oil and there's the essential oil and let's add the two. It's how many drops and what type of carrier oil.
The type of carrier oil isn't as crucial as the type of essential oil that goes into it.
Let's mention just a few so people can understand, like your avo, your jojoba.
The carrier oils, almond is a common one, grape seed oil, jojoba, avocado, hazelnut, and then there's the whole macadamia nut. Those are all wonderful oils to use, but they're commonly available, but it's what you put into them that matters. And each oil has its own fatty acid profile and has its own benefits, and you would use them differently. If you're wanting an oil that was more astringent, if you want to use that term for an oil, you would use grapeseed. If you want one that was a bit more emollient than that, you would then choose almond, for example.
That's why it's important for people to not self-treat, but actually go and visit an aromatherapist.
It is helpful,
especially when you're treating someone else. I mean, if you do something wrong
to your own body,
then you need to deal with it. But if you've done harm to another out of your goodness of your heart, that's a difficult one to live with.
And particularly for children, the elderly, wherever there's frailty of any convalescing people, skin that is changed or compromised, all those factors play into how the essential oils will penetrate, what they will do, and the effect that they will have on the skin. Whereas through inhalation, it's less acute as far as the topical compared to the topical application.
I remember you doing a lot of work with Red Cross Hospital for Children. Tell me a little bit more about your work there. Was it burn wound?
I didn't do, no, that's
Did you
not work
donate
I do
oils?
that. I do donate oils there, but I don't personally work at Red Cross. One of the members of our association does run a program there where they work with the burns children, and that's a wonderful program that she's in charge of. But we worked, and I was involved in aroma care plans in other parts of the world. In cancer care, we worked a lot at Grooteskier with the Brooklyn TB babies.
Good pause. Cancer care. You're talking about treating nausea post chemo?
It was really going in, taking our students in for their community service, to take them in once a week to a specific ward where the hospital had given us all the go-ahead to do, and the students would go in and do treatments on hands and feet and where they could reach for patients who were in isolation units and in laminar flow rooms, and bring some comfort to them.
That must have been really difficult for you to get the green light to go in there with aromatherapy oil.
That was a long time ago. That was in the 1990s that already started, and that program ran for about 10, 15 years until the registers opened and those requirements were no longer necessary. It was something that was self-regulating, that as associations we put in place, putting our students into community care for that part of their training. And they worked with cerebral palsy children, they worked with people who had mental disease at Valkenburg. You know, it was quite a wide outreach for where we could actually offer services. But the Grooteskier one was a big one, and it wasn't just Cape-based. We had projects throughout the country at that time.
I can have you here all day. But I mean, just summarizing it in, it seems like two very distinct categories. It's the therapeutic aromatherapy that is practiced by a qualified practitioner, and it's for therapeutic reasons.
Yes, who needs to be registered in order to practice, for it to be legal.
Right.
Because there are people who are qualified who do not register or have deregistered. And if you practice when you are not registered, if you practice any registered profession as an unregistered person, qualified or not, that's actually illegal.
Right.
According to the law of this country.
So you should actually ask for someone's certificate when you
they should
go
have
and
it.
visit
They
them.
should have it
on their wall.
Yeah, that's all.
Other than that, you buy a pre-made essential oil product either from an aromatherapist that you use yourself, or on your children, or on an elderly parent, or you go commercially. And then, you know, that's the last...
You take your chances.
Yes, so that's the last question I have, is a lavender oil.
Well, there's so many different lavenders for starters, so that would depend on the base botanical plant of what
apples
is.
with apples. If you see those two in the shop,
just
what
two.
to look out for, different makes.
It's important. I won't speak to makes because you know that's getting into.
No, I don't want you naming
territory.
companies, please. But just let's say there's lavender oil from company A and lavender oil from company B. A consumer cannot assume that they are identical.
You cannot, not unless you have the chemical analysis to refer back to. It's called a certificate of analysis, or the actual chemical printout called a GCMS. Unless you have those, it's very difficult to look at a closed bottle that says lavender and will say lavandula and gustifolia on it, and to know how was it extracted. Was it appropriately extracted? Is it a pure oil? Is it a nature identical? Which a lot of people are saying lavender, putting the botanical on, but we've discovered that they're actually nature identical oils, or they're blended oils, and those are not pure essential oils. They're going to maybe smell a bit similar, but their actual method of action and their properties will be different.
So the way you can use them therapeutically would be really very different.
They might be indicated sort of on the aroma olfaction side of things, for similar things, for maybe calming or for stress. But certainly when you take them out the bottle and you start applying them to the skin and you look for a therapeutic outcome, if what it says is not truly in that bottle, your outcome can differ.
A concern is obviously the sustainability of essential oils. Where are we with that?
It is a very real concern because so many people have been using aromatherapy. Certainly it had its heyday where it was in everything you could think of. It wasn't always essential oils, mind you, but the term was used quite loosely. But then people did start using a lot of essential oils when they became freely available. And over the years, some of the oils have become endangered. And for a long time, we weren't able to buy any Mysore sandalwood, for example.
Right.
And slowly those, the Indian government have replanted and the trees are growing and they're harvesting again. But that was certainly an endangered oil.
So they stopped selling it until they've planted more trees?
It should have, yes,
it
should have
right.
been, and for a while you couldn't get the oil at all. And people also who were ethically minded stopped using it because they didn't want to fuel the whole exploitation, because it was still being sold, but one wonders what was being sold. Because if there wasn't a supply, how could the demand be met? And there is a lot of that. There's adulteration and exploitation and all sorts of things in the essential oil industry as much as it is anywhere else. And rosewood is another highly endangered oil. We should not be using that oil. There's alternatives one could use, like hoe wood, which give a similar chemical profile if you're looking at
right.
oils that way.
So it'll still give you that therapeutic
it'll
action
get that
that you
action
want.
that you're looking for without having to use the true rosewood, which is endangered. And until those plantations can be harvested again sustainably one day, it's best not to be using those oils if you can buy them. A lot of oils that are blended are available, however, but that's not a true oil. That's a synthetic. They just use the chemicals that would make up a rosewood and sell a blend. And the same applies to rose. It's very expensive. So if you can buy a bottle of rose for 30 Rand or 40 Rand or 50 Rand, you're not buying rose. You're buying hope in a bottle. It's not rose.
I was fascinated to hear. We had a conversation about sandalwood some months ago, and there's Australian sandalwood, Indian sandalwood, and Hawaiian sandalwood, and that's it.
Pretty much.
Right.
Excuse me. And the thing that concerns me a great deal is recently, from some of the groups that I interact with, it's been shown that cedarwood, Atlas cedarwood, Cedrus atlantica, is becoming endangered to some extent. And that really is a concern because that oil is so widely used and in so many products. So we need to be mindful of that when we're using the oils and also when we formulate with them.
I would love to see more good quality essential oils available on South African shelves. There are some good ones, but also that offer sustainable, organic, where possible, essential oils.
In an ideal world, that would be perfect, but it's difficult to source some of these oils, and a lot of the distillers haven't actually got organic certification because it's so expensive to get that. So there's some wonderful distillers across the world who are actually producing organic oil or wildcrafted oils. They just don't carry that certification, which doesn't mean that oil is bad. It's just a case of really needing to know where your oils are coming from. As with the food we eat, we need to know our sources and then to make up our minds and our choices mindfully, I think.
But you no longer would call yourself a practicing aromatherapist in the true sense of how you trained other aromatherapists?
No, I don't really do any body work anymore. I use aromatherapy more in a naturopathic form in my practice, which is my special area of interest. So I would formulate a remedy for patients, say, with eczema, because your eczema would be different to my eczema. So I would then, after a consultation, be able to create something that is specific to that patient's needs. So not that aromatherapists don't do that, but when it comes to internal use, I might also need to make suppositories or pessaries for someone, or give them some internal oregano to treat candida or whatever's going on. So I find that my scope, because I'm allowed to do that, is better to express what my primary interest is, which is aromatic medicine, rather than only restricting it to topical massage or inhalation therapies.
Right. And with your mind, I wouldn't want it any other way.
I'm losing a lot of the grey cells, I think, as we sit here.
So what's the aromatherapy medicine for that?
Oh, there's a lot.